Here to unpack these regulations, I'm joined by the Deputy Health Minister, Dr. Siboniseni Dlomo. Deputy Minister, good evening, and thank you very much for your time. In my conversation yesterday on this particular matter, those who are opposed to the proposed amendments, particularly the Democratic Alliance, they are raising the question of the minister wanting to have unfettered power to lock down the country as and when he sees fit without consulting even health professionals. What do you say to that perspective that is being promoted or being spread by the opposition party?
Thank you very much, Thabo, and thanks to your viewers. And thanks for touching a little bit on this issue of the extension, which I probably need to start there, that we have noted the concerns from the greater number of South Africans to say that the time that was given up to the 15th, which is tomorrow, probably was not adequate enough. Can we extend it more? So we have really, today, Minister announced an extension up to the 24th of April, next week, Sunday. Again, maybe before we finish here, if you would allow me, I could give you other communication channels other than just that one email, which is an extension so that many more South Africans then can put their comments. No, Thabo, we are not intending, as you actually got that clip from the minister, we are not intending to have these issues for long and actually extended beyond in the reasonable time. The main point here, Thabo, is that we still have COVID-19 infections. There are still people in the hospitals. We're still getting every day some, though they are small, but the disease is still there. So this is just to allow us to transition. As you now know that the state of disaster has ended, and then there has been a 30 days of this transitional period of rehabilitation and recovery following the Disaster Act being stopped. We now have to come in as health so that we could allow the minister to really make some regulations around notifiable medical conditions, which is what he actually mentioned is not something new. It was there in 2017, but it's just that it did not include issues related to COVID-19 of a droplet spread type of an infection, where we now want to say we would want to really, for a time being, and I can tell you, by December, these regulations may not be effective, depending how we deal and control the infection going forward. So these ones are to actually assist us to strengthen the control that we have since seen, the control of the pandemic by quarantining those who will be found to be positive at that time, mandatory prophylaxis, and examination of any person who actually is showing signs and symptoms, and be able to give them time to take the specimens and forward it. So those are the ones that are around the notifiable medical condition of COVID-19. The other one is, of course, of the mask, especially only indoors, and also a bit of regulations on gatherings.
Yeah. So, I mean, that's really the question, particularly on what is a notifiable disease. The challenge that is being brought by the Democratic Alliance is that you have extended what that definition really means. Let's play you a clip of what the Democratic Alliance said to us yesterday around what a notifiable disease actually is.
So in terms of the regulations, the Minister of Health has the powers to put this country into lockdown without receiving any advice from scientists or specialists in the medical field. So that's a worrying factor. I mean, that regulation, the way it reads, needs to be changed. I mean, you cannot allow the Minister of Health to have these kind of powers inflicted on South African citizens. I mean, we all know that this country has suffered severely in terms of the economic perspective.
So what else didn't come out there is that they also says that this will force compulsory medical examination, test and treatment for certain notifiable diseases which were previously it was previously not compulsory for these to actually be examined and tested and treated in such a way as we have done with COVID-19. Just explain to us how that particular aspect of notifiable disease differs from what was previously in place.
Yeah, we were strengthening this aspect of the notifiable medical condition in the regulations. And number two, Thabo, let me mention that it is not something that is going to permanently be held on for as long as we have COVID-19 infections and as long as the disease is still there in our communities. We would want to say anybody who actually would be tested and found to be positive will have to be actually mandatory given that space of quarantining. We cannot allow, because it's a droplet spread, which we know if I am positive, then I should not be pushing it and spreading. So the quarantining is not necessarily quarantining in any sanatorium, but quarantining at home. This is a way of controlling the infection. Number two, we would be saying that if it is really showing some symptoms, we are not going to expose it to any other person other than the professional, health professional to actually examine you and confirm that you do or you don't have. That is one of the ways to act. And say number three, that we should then allow that health professional to take specimens that could confirm or not confirm. Now, this is actually strengthening, this is what we see, the pandemic of COVID-19 is actually informing us, and we were informed by scientists. We don't want to go back to lockdown. And in fact, I could imagine that member of parliament did not read properly what we have written. The Minister of Health has no powers single to just lock down the country. That is why, if there was to be an escalation of a pandemic, the Minister of Health will have an obligation and responsibility to inform other ministers, because we don't have within health powers to lock down and also say this must happen in the transport, this must happen in the trains. It is another that is beyond the minister's duties. It will have to be an interministerial discussion. But the Minister of Health will sound an alert of the things that he sees or things that are actually brought to his attention by the medical team and the other experts that work with the minister.
Yeah. So do we still treat those who are asymptomatic in the way that we are treating them now? Because, I mean, currently the regulation doesn't require those who are asymptomatic to actually go and get a test.
Yes, we don't need to. The regulations are not actually saying those who are actually asymptomatic should really be put on a test, yes.
Okay, so they don't have to go for an examination if they are asymptomatic.
Asymptomatic, yes.
All right. Then let's talk about this other question then that is also being raised by the DG on mandatory prophylaxis treatment. What actually that entails. If you're saying if I'm refusing to isolate or I'm refusing to take a vaccine, the minister can force me to stay at home. We'll talk a little bit on that when we come back from the break. Do stay with us. The Deputy Health Minister, Dr. Welcome back. We're still with the Deputy Health Minister, Dr. Sibongiseni, and he's, of course, explaining a little bit further what the amendments to the Health Act actually mean. Dr. Zlomo, now, yesterday we heard that, of course, as the mandatory prophylaxis treatment, the only one that we currently have in the country, of course, would be a vaccine. So are you saying via these amendments we are not in a kind of roundabout back way, forcing people to take COVID-19 vaccine? Does the mandatory treatment include vaccinations?
It would also be important for us to talk about what is a public health approach in an event of a pandemic, of a droplet spread type of an infection. This is a new infection and it's defined as a droplet spread. If you cough, sneeze, shout, open your mouth, some droplets get out of you and into the space here. And if we then find you that you are symptomatic, we would want to then offer the things that are there for you to not have that to be spread. One of them is vaccine. But there's also one of the things, it would be mandatory that we isolate you from spreading it by actually, among other things, quarantining and keep that person until you are better, and probably then treat symptomatically what you have. The vaccine, according to what we have in the country, is actually we pledge, we request people to, we will not, and we have not taken the decision to force them to take the vaccination, but it will be a plea to take the vaccination. For now, it will be prophylactic treatment according and around what you do have, without really squeezing and forcing you to take a vaccine as actually a prescription and a mandatory.
Yeah. The other criticism is that you will be placing a burden, for example, on employers. You'll be placing a burden on churches and other people in as far as these tests and all this admin that they would need to do around this public health intervention on COVID-19, at least in the interim, as you put it, because it's not a permanent thing.
We are actually calling upon our South Africans to support these regulations, which may not be in place for long. It is just to take us over this. And in fact, in the words of the minister, we are not yet over this problem of COVID-19. But as we're approaching winter, depending what the new variant is coming in to do, and depending whether we really continue really pushing ourselves to wear masks indoors, and push up the vaccination to those who are willing and available to vaccinate, come September, come August, we may just be over the very risky programs. And then at that time, you then find that because this is not in the act, you put regulations that is just to around, and regulations may not remain there permanently. You may find that some of these will have to fall off by August, September, and that is what we are really requesting South Africans to really support this program going forward for now.
Yeah. You've taken into account the fact that most South Africans have developed some kind of natural immunity, having contracted the disease and recovered from
it? The scientists do tell us that part, Thabo, but that's why we are very happy with the vaccination and probably post-infections of the elderly citizens of 50 years and above, where they are vaccinated up to 70% by now. So we would want to push most of our younger ones, the 18 to 34 years, are vaccinated right up to 35%. That is really the population would like to push higher up. And like I said, I would not want to end this without really giving you that these comments on regulations, please, if they could still be forwarded on our new WhatsApp number, which is very easy to remember, 0600 123456. 0600 123456. We have added another email address so that we don't have that one that our people have always used, sakane.fumalele, is still continuing. But there's a new one now, which is legal reviews, very easy to use. Legal reviews, one word, at health.gov.za. So now we would think that opening it up for one more week up to the 24th and having these two additional pots to enter into will probably make our South African people to push as many as they can within this short space of time, and then to analyze. Of course, the analysis is continuing. It's not going to be starting only after the 24th.
All right. There's a whole lot of information being circulated, for example, around emails being deleted before being read. Is this all just politicking, or is there some glitch or something happening in the system that allows for that to happen?
There was a mistake. Okay, firstly, Thabo, we have received over 150,000 comments, emails, and then that is now being processed. Some of them, there are certain individuals who duplicated their responses, but that will all be audited. Number two, yes, in the course of moving some of the data to other systems, there were some deleted items, deleted emails. They have since been retrieved, and they are now back into the system, but everything will be transparent and open, and there will be a clear audit of that process, and that will be made. The minister will really make all that available to all South Africans. All we are requesting now, they continue sending their comments on these regulations, and they will actually, there's a team that is already there, Thabo, that is continuously on a daily basis looking into that and putting them into different categories as they see the responses coming in. So the work already started to look into that, auditing and categorizing all the regulations responses, so that we could, maybe a few days after we close on the 24th, ready to then tally everything and then be ready to release through the minister what actually has transpired from these comments of the South Africans.
How do you feel about the religious organizations saying that government tends to have these consultative processes? They get everybody around the room to sit around the table, but they hardly ever take any of their inputs into consideration. So even this process of the amendments of the Health Act would work out exactly the same way. They're saying we'll go and participate or give our inputs, but there's really no any guarantee that this will be taken into account. In fact, that's why they are deciding that come this Easter, they just will not be observing any of what you say they must observe.
Probably not true completely. There are certain religious leaders who sit and actually do give us advices. For instance, one, I can actually make one. They were saying, if you are now saying you are opening up and actually getting and stopping the rotational attendance of primary school children, because we are now actually looking into bringing them all at one time. What stops you to consider getting all our children on a Sunday school to come at one time and not? And then we considered to that. It made a very reasonable statement from the religious leaders. Number two, there has been a request to say, we don't understand why you are treating the funerals as different gatherings, and other gatherings you have these numbers. And that actually has since been considered too. Again, there's been an improvement and an increase in the number of people who can attend funerals based on the input by the religious leaders. So some of the issues, yes, we take it, but it's not completely that they are ignored completely. There are certain things we're really not finding each other very well. The issues of saying, let's open up a 6,000-seater auditorium to half of the people there, 3,000, but then there must be evidence of vaccination in that. So they are actually not really all of them are supporting that part. That is where we actually are pleading to say that indoor facility of a 6,000-seater auditorium, half of the venue, 3,000, but then we would want to see them vaccinated. So outdoors, even no need of a mask, and then that's fine. They could go up to any number and not actually having any challenge. But we are pleading and we are talking to the religious leaders continuously, and that is under the leadership of the Deputy President. We all participate in those meetings, but the Deputy President leads those conversations. They are very common and they are taking place on a regular basis.
All right. To be perfectly clear, I'm paraphrasing here. I don't think this is exactly what she said, but she said something to the effect of, as a member of Parliament, amendments to the Act are treated almost similar as regulations, and so Parliament doesn't necessarily play oversight over them. In a sense, saying, well, you could go through this consultation process and just go ahead and implement these amendments as you so desire as the department. Is that necessarily true?
Regulations are not like the actual bill or act. These are regulations to make sure that the system, the act, is able to be processed. You do inform the National Assembly, members of Parliament, but you don't really need to have them say yay or nay for you to actually go on with the regulations, because there are regulations. They are not meant to be actually agreed upon by members of the National Assembly or members of the Portfolio Committee. We were briefing them today. That is my understanding, at least in terms of regulations, in terms of the Act. Regulations are to allow the department to process the Act in a particular way, and that they actually come and go. And regulations may not necessarily permanently be there, but they take you over the particular challenge that you have with the Act. So certain things we always say that, but what you are raising may come to an Act, may be part of the regulations in terms of how many people can do this, that, and the other. It may not necessarily be specific on the Act, and it may come and it may change as and when the situation actually changes.
All right, Deputy Minister, appreciate your time and thank you very much for coming on. Deputy Health Minister there, Dr. Sibongiseni Dlomo, clearing some of those issues around the amendments to the National Health Act.